So, hi everyone. Thanks so much for having me and thanks for your patience. My name is Sarah Houston. I'm, come on in, Evaluation and Insights Manager at UCL Partners. And I'll be talking about the development of our UCL Partners Insights platform and what we've learned from developing this platform to explore our population, visualize our challenges, and track progress, all with an aim to drive change and upskill decision makers. So, why did we develop it? UCL Partners is a health innovation partnership based in North Central, Northeast London, and then South Essex. We cover a population of just over 5 million people across 21 local authorities. And because we cover such a huge space, we cover a really diverse population with diverse needs. We have stark variation in deprivation and isolation across our patch, where we have extremely dense urban areas such as Camden, all the way to rural areas in the north, like Braintree, and then coastal communities like Southend-on-Sea. So as a result, there's a huge volume of open source data that's available to us, which we and our partners really find it difficult to root through to answer our questions. So our challenge was how to use this data to prioritize our work. We recently developed a new 5-year strategy, and it was very challenging to identify what our population needed and where we could have impact. And secondly, to make what we understand about our population consistent. We have multiple strands of projects, programs, and partners, all using very different data sources to tell the same story, which not only makes it difficult to compare across programs, but of course takes up time and valuable resource. So a solution to this was to combine all the open source data we had available to us, from OHID to ONS, meteorological data for carbon, identify metrics which could be presented in a cohesive, curated format, which we could then use to learn more about our population, identify our challenges across our 8 main priority areas, from climate to dementia, and then monitor our impact on them over the time using the platform. Once we'd identified our 8 priority areas, the next stage was engaging with stakeholders, so clinicians, researchers, operational staff, to understand what are those key metrics which would be most important to them and what might we have impact on. So we wanted to ask them what they're worried about for their population, what's the one question they ask all the time, and what metrics do they already use on a regular basis, so that we could start to generate a long list of metrics we could then refine. And part of this was not only trying to repeat what's been done before, but to improve it. And what we found when talking to stakeholders is they had a few things that they suggested. Firstly, they wanted to see metrics that considered our population from different angles. So, for example, looking at diversity, not just with broad ethnic categories, but also looking at language. Secondly, there was no central place where stakeholders could see the progress we'd made on our priorities over time, and nowhere that co-located different related data sources to tell a story about each priority. So, for example, when looking at cardiovascular disease, they recommended including data that could tell us about each stage in the path. So, for risk factors such as smoking, to incidence of coronary heart disease, and then finally A&E admissions for heart attacks. And as we cover a broad region, that includes loads of different boundaries. So 3 integrated care boards, 21 local authorities, 2 NHSE regions, we have to map our own geography quite often across lots of data sets. So we wanted to include data which could be combined and divided across all of those partners. So from that metrics long list, we also need to establish which metrics were feasible to be included in the platform, so which were relevant to our priorities and our population, which were reliable. We wanted to make this an updatable resource, so really what data is still going to be available in 2, 5, 10 years' time. And with that is the available data recent? Is it also accurate? So do the people who use this data regularly see it as reliable and actually reflective of reality? And finally, we only wanted to include data sources that were truly open source, so available to everyone, not just locally collected and not just available with an NHS Net account, for example. So now we have a shortlist. We wanted to explore what a platform to display this data should do. And in terms of what stakeholders wanted to see in a curated platform, they described 3 areas of focus. So describing our population, identifying our challenges, and tracking our progress over time. So to describe a population through a small number of clear metrics to accurately depict the communities that we support, including demographics, deprivation, risk factors as well as life expectancy, to describe what might be causing ill health in the population. Next, showing the current status of challenges in our communities, and describe what changes have occurred over time, so we can understand the scale of the challenge faced in each area. And then finally, how moving forward, we can track our progress on it. This structure was then used to guide the Insights platform, which is built in Tableau and is currently available to everyone on Tableau Public. And you can see at the bottom the main structure mirroring what stakeholders requested. And this is the general structure of each page of the platform. So we navigate through pages through the icons at the top. Each page has a visualization as the kind of key metric. And we wanted to make each one engaging, but also informative and accurate. And on the left, we have a plain English summary of each graph. And below that, we have a key insight gathered from it. And you also have filters to look through ICS and boroughs. So whether you have 10 seconds to look at each page or 10 minutes, you're able to get something from it. One example of the type of insights we've been able to gather from the platform is in diversity in our region. So ethnicity, according to broad ethnic categories, may seem very similar in adjacent boroughs in central London. However, by exploring language spoken, we can look at different communities to engage with. So in this example in Tower Hamlets, there are 44% Asian British in the population. And Newham, which is the borough next door, appears to have a very similar proportion of the Asian British population at 42%. However, we can look at the main language spoken to delve further into the diversity of the area, beyond broad ethnic categories, and use that information for better engagement with our communities. So if we exclude the English language in Tower Hamlets, we can see there's a large community of Bengali speakers in the region, about 10% of the overall population. However, when exploring Newham, even though it's an adjacent borough, and it only takes 10 minutes to travel from the centre of Newham to the centre of Tower Hamlets, we can see the spread of languages spoken is very different. And we've got a larger number of smaller communities we would need to consider engaging with when implementing health innovations there. We've also included data on deprivation on the platform. And what our stakeholders wanted to know was, what does Core 20 mean for us in each region? So, as brief background, the Core 20+5 framework was introduced by NHS England as guidance to address health inequalities. Core 20 referring to the most deprived 20% of the population. So the identification of the cohort is really important. And you can see here, each bar in this graph is a local authority. And the coloured area is the proportion of the LSOAs in that region who are in the Core 20 population. So you can see it's very different across our patch, but also very different in ICBs. So if we take North East London ICB, for example, Barking and Dagenham has the highest proportion of Core 20 LSOAs across the patch. But Redbridge, which borders it to the north, has one of the lowest population. So that insight can determine how the ICB prioritises its work in accordance with Core 20. Next, in challenges to address, we explore specific metrics which our partners felt best represented our work and what we could have impact on. Something we were keen to show is not only the data, but also what it might mean. So acknowledge limitations in a clear, easy to digest manner. So for example, here on the left, when exploring new cancer cases in the population, we also added a comment clarifying the impact COVID would have had on the cancer data from 2021. And we've been asking our colleagues and stakeholders feedback on their initial use of the platform. And what we found is promising in that people have been using it to establish and describe their populations of interest, doing so in an automated way with limited risk of duplication of effort. The platform has increased awareness of our partners of inequalities that they can see across the population. And then finally, having this curated resource of data that's already out there has helped a lot of our colleagues in developing their own data skills by looking through the metrics we used, diving further into the data sources that we reference, and then finding out more measures and metrics that they would like to use in the future. And we've had feedback from colleagues that it aids understanding of the data, including these alternative metrics such as language, has helped colleagues understand the broader needs of the population they work with. And then finally, just pulling together these snippets into a single place has simplified the process of accessing it as well. And what we've learned from our conversations is that presenting data in this way has encouraged engagement with and increased awareness of existing open source data, particularly by people who don't usually work with it. And we've also found when co-developing these metrics that the traditional metrics we tend to use, like broad ethnic categories, are recognized as limited, and we can do much more in defining our populations. And finally, most of the metrics we've used in the past derive from acute care, such as admissions for myocardial infarction, but our work increasingly focuses on prevention and targeting of conditions like cardiovascular disease upstream. So for us, there's also a learning curve transitioning to this kind of data. So now we have this platform. We don't want it to sit on a shelf and gather dust. We want to make sure it's sustainable. So we'll be updating it regularly and encouraging our stakeholders to use it. Part of that engagement will also involve publishing specific insights from the platform and social media, so we can get a conversation going about it, and we'd love you all to take part in that. As update of the data on the platform is often quite complex and extensive, we're also setting up a knowledge library and a pipeline of the data through R. So there's a central place we can collect, clean, and prepare all the open source data, both for the platform, but also for us to use internally. And we're planning to share that publicly as well. And we will also be evaluating the impact of the platform over time, which we'll be exploring along each stage of our innovation pipeline that we work within, you can see on the right. So from supporting innovators in applying for pilot funding in our kind of discovery horizon stages, all the way to gathering insights for a large program of innovation after it's been launched. And we'll also be incorporating feedback about the platform into our product roadmap, which will lay out in a really transparent way what people have requested for the platform, what we're changing in it, and why. So that will hopefully keep people engaged and involved as the platform changes. And with that, I'd like to thank our Insights platform team, and please search for the UCL Partners Insights platform on Tableau Public. Hopefully you can get something from it, and happy to take any questions.
Do we have time for one? Oh, sorry. Don't worry about time, we have to go basic politeness. Maybe we have time for one question.
So this is lovely. It's really clean, lovely, and soothing. My question is who's it for? Who's it for? Is it open available to get that view from you?
Yeah, absolutely. So in terms of its design, it was designed kind of primarily for us internally, but also for our partners. But in terms of its accessibility, it's open to everyone. So it's on Tableau Public. You can look up Tableau Public, UCL Partners Insights platform, and it's there. And then we're hoping in the development of the kind of knowledge pipeline as well, that will all be available on GitHub. So at least the process that we use to prepare all this data, getting it ready to put on the platform, will be open, as well as you being able to access the platform, for example, seeing visualizations you might want to steal, feel free, and metrics you might want to use as well.
Cool. Thank you so much.